right. Hello, everyone. Happy May Day. And of course, I mean that in the good sense, not the help sense. May 1st, I was just reading about May Day, and we're halfway between the spring equinox and the summer solstice. So hopefully that means all good for everybody. And we're glad that you have chosen to spend some time with us this afternoon for the first webinar of May 2025. Looks like everybody is muted. Thank you. You can please stay on mute while we're presenting today, and then feel free to use the chat feature if you have questions and comments. And our speaker has already agreed to answer questions after she's done presenting. So you'll have the opportunity to unmute yourself if you would like to ask your question out loud. Otherwise, feel free to use the chat and the closed captioning feature at the bottom of your screen. There's a button that says CC and show captions, so you can enable that as you choose. We are recording, and this webinar will be available later this afternoon on our YouTube channel, and we will send you the link to that in next Monday's My Alliance newsletter. Next Monday is Cinco de Mayo, so all kinds of fun observances coming up. And even more fun, we'll get to hear about the AROMA study and the sense of olfaction today from Dr. Jennifer Vilwalk, who has been a guest presenter on the webinar before, and we're very happy to have her back today. Dr. Vilwalk is an associate professor here at KU, and she's a native of Muskogee, Oklahoma, and she is a graduate of both the University of Michigan and Michigan State University. So you don't have to pick Dr. Vilwalk, right?
Yeah.
Whenever they
And
have
and no
sports.
one will ever know the real answer of who I truly support in college
I think
football.
that's,
Yeah.
yes, I think that's probably safest. My dad is a University of Michigan grad, so you can tell which side our family is on. Anyway, we're here to talk about you. Besides those fun things about Dr. Vilwalk, she is a fellow of otolaryngologic allergy, which is why she can tell us about the AROMA study. And I think this is lovely. In 2020, she won the Rainbow Award, which was a marker of her professionalism, integrity, and commitment to mentoring future physicians. And we know for sure that she is kind enough to share her knowledge with us on the webinar. So, Dr. Vilwalk, welcome, and let's take it away.
Yeah, so I'm gonna share my screen and it looks like it's working, so let me know if it's not. But
That's
like
perfect.
Kelly said, yeah, I'm Jen Vilwalk. I'm in the Department of Otolaryngology. So a lot of things, if you look at my resume, they're all tongue twisters because they're super long words, but it's another way to say ear, nose, and throat, or head and neck surgery. And the area that I further specialize in is the nose. And as you will see, there's a variety of reasons why I think that it's important, and it's all related to the AROMA plus ML, which stands for machine learning study. And the reason that I care so much about it as someone who specializes in the nose and sinus disease and allergies is that I learned years ago that where the nose goes, health goes as well. And so I'm going to talk to you a little bit about that to kind of set the stage to give you some more information about the study that we're doing. And just two disclosures, because it's always important, to act with integrity and honesty. So we do have a patent pending through KU for one of the olfactory or sense of smell tests that you're going to hear me mention. And then we do also have funding from the National Institutes of Health to study this brain and nose health connection. So anything that I say is just my opinion. It doesn't necessarily represent the views of the government. And like I said, the reason why I care so much about olfaction is because really the brain seems to be following the nose in terms of health. And this for me was a really interesting fact that I learned many years ago, which is that for a lot of cognitive issues, so things like dementia, Alzheimer's disease, etc., it's actually a pretty well known and documented finding in the studies that have been done that sense of smell is one of the first things that starts decreasing as you get an increase in these issues with cognition. And so that leads to the question of like, well, why don't we more routinely monitor that? And how could we potentially leverage that information to our benefit? And that's the reason why several years back, if you were an avid Dr. Oz fan, you would have seen one of his episodes where he was talking about this new at home Alzheimer's smell quiz that you can take right now. And this doesn't exist like commercially available, but they did provide some good information about that link between brain health, dementia risk, and sense of smell. So you don't have to take it just from me. Dr. Oz also agrees that this is a really important topic. And when we think about, well, why would there be this link? Well, we know that olfaction or sense of smell is really important, and there's actually a very large amount of the human genome that codes specifically for things that are related to sense of smell. And I think most of us understand kind of viscerally, like, yes, sense of smell is important. It tells me what's good to eat. So this is a picture of my daughter when she was much younger, as we were trying to tell her, please don't eat apples off the ground at the apple orchard. But it's also very important in terms of sense of smell for safety, right? So that's why they put a scented chemical into natural gas that smells like rotten eggs so that you can detect if something is bad. It's another reason why, for example, people that have a decreased sense of smell, especially as they age, can be at increased risk for GI upset. Well, because potentially if you're not detecting, that those leftovers have gone bad, you could be eating stuff that's rotten, and that could be leading to some of those GI issues. But we know too that sense of smell is really important just for your overall daily life and for making and establishing memories. And that's the reason why there's actually a really big industry surrounding, well, what does a particular brand smell like? Like when you walk into Starbucks, it's always going to smell the same. When you walk into certain stores, it's going to have the same smell, or a hotel, because they want you to associate that smell with them. And in most cases, with like, let's spend some of our money here. So it's super important. And for folks that have dealt with any sense of smell issues, one of the first things that they often talk about is how this impacts food, and particularly their ability to enjoy it. And I really like this picture here because you can see that there's two different things that are needed for you to perceive the flavor of something that you're eating. So one of them is taste, and that's primarily encoded through the tongue. And this is very simple sensations like this is sugary, this is salty, this is bitter, this is sour. But if you want to be able to get the flavor of something like, oh, this is sweet like apples, or this is sweet like strawberries, you really need the input from your nose and the sense of smell system to put that together and have it relay an actual flavor for you. And for me, as a person that sees a lot of folks in my clinic and in my research that have olfactory dysfunction or issues with their sense of smell, I've noticed a couple of things. So the first is that lack of awareness can be very common. So people aren't always aware that number one, their sense of smell maybe is decreasing, or the extent to which it is decreasing. And one of the examples that I always think about is we were once testing the sense of smell of a couple, and the woman in the couple was basically making fun of her husband, saying, oh, his sense of smell is the worst, I have the best sense of smell, etc. And he's just smiling and nodding, and you can probably see where this story is going. But when we actually tested their sense of smell, it was the opposite. He actually outperformed her. So people are not always aware. But for those who are aware, and I think now about the COVID pandemic, and it really put olfaction or sense of smell on the radar for most people. And those folks who lost their sense of smell, it had a huge impact on their quality of life in terms of, I can't taste my food. I don't know if I put on enough deodorant today. You can imagine how there's so many reasons how this could impact you. And like I mentioned before, olfactory dysfunction is associated with a variety of other medical conditions. So things like cognitive impairment, dementia, Alzheimer's disease, but also other conditions. The more we look, the more we find things. So certainly it's associated with things like allergies, sinusitis, and some other disorders as well. And so what have we been doing? And what is this AROMA ML study that you might have heard about? Well, what we're doing is we're trying to test this association, or see how strong the association is between how folks do when we test their sense of smell, and how that relates to things like how they perform on cognitive testing. Um, pardon me, health questionnaires. So is sense of smell related to overall health? Is it related to how well they can get up and walk around? And then we're also interested to know how well can sense of smell predict other things that can be very expensive or hard to get. So you all are probably aware, if you've been going to these webinars, that there's different plasma tests or blood tests that can be used to look for different markers of different diseases. Well, it would be really interesting if we could say, hey, first we'll screen you with a sense of smell test. And if you do poorly, maybe those are the folks that need the fancy blood test or the folks that need to get an MRI. And so that's exactly what we're studying currently. And so we are still enrolling. The one change from what you see on the slide here is that we have already filled up our cohort of healthy control, or folks that don't have any sort of cognitive concerns. So we're really trying to find folks now who either have mild cognitive impairment or have been diagnosed with Alzheimer's disease. And for a lot of folks, this can be really fun to participate in because sense of smell is not something that you're typically tested for at the doctor's office. So it can give you some interesting information that can immediately translate into changes in your own life. So if you do know that your sense of smell is decreased, you want to make sure, like, oh, I need to make sure my smoke detector is working and that I didn't just take out the battery because I couldn't stand it beeping at me anymore. It needs to be functional. You might want to take some action to do things like label leftovers so that you don't accidentally eat food that's not good anymore, etc. And we're interested in knowing too, well, how does your sense of smell today, can that predict how you're going to be doing, not only from a sense of smell perspective, but also how well you're going to perform on cognitive tests a couple years from now? Because that would be very helpful information to know as well. Because, for example, if we learn that there's a pattern of performance on our olfactory testing that predicts this group of people is going to be doing great in 3 years, and maybe this group of people is going to be doing not so great in 3 years, then from a public health perspective, well, now we have a tool that can help us focus on the people who are going to be most in need of our help. So that's kind of a brief synopsis of everything that we're doing with the AROMA plus ML study. And the reason there's that plus ML study at the end, I mentioned at the beginning that stands for machine learning. When you are a scientist and you have all this data that you're collecting, we have our smell test, which tests multiple different scents at different concentrations. We have these questionnaires, cognitive testing information, etc. It can get really hard to analyze that data just using the regular methods that we do. And so one of the ways that we use machine learning is to help us most accurately make the predictions that we're interested in. So predicting how people are going to do in the future, predicting what their blood tests might show based on their olfactory performance. So that's where the machine learning part comes in. And it's interesting too, because as we get more people into the study, the algorithms should get better and smarter over time, which is something that I'm excited about and hoping to see in our work here. So I won't take up too much of your time. That's kind of a brief synopsis, but I'd be happy to take any questions that you may have.
Wonderful.
And it
Thank you.
can be about the study. I know allergies are bad for people now too, and I do a lot of allergy stuff. So whatever is most helpful for the people that are watching, I'm happy to answer those questions.
I love that. Thank you, Dr. Vilwalk. And as people think about their questions, I just want to point out that in the chat, I have a link to the AROMA study. And it's a special link that is connected to this webinar. So if you all would use that link, if you can, we'll know how many people will watch this webinar and then clicked on the link, and that's helpful for research purposes, right? So feel free to take that. I see some hands raised. I'm going to go with a question in the chat first, just because I saw it first, and then we'll go with the folks whose hands are raised. So in the chat, we have, what can we do to improve our sense of smell?
Yeah, that's a great question. And there are things that you can do to improve your sense of smell. The way that I think about it, and apologies if you see my husband in the background cutting the grass. If you see someone walking by creepily multiple times, that's my husband and he's cutting the grass. To help improve our sense of smell, you can actually do olfactory training. And so if you've ever known people that are trying to become like wine sommeliers or do similar things, they make little kits that you can actually purchase and train your sense of smell. What has been studied multiple times, not only in people with normal sense of smell, those that have lost their sense of smell because of a virus, because of a brain injury, etc. Usually what's recommended is a panel of at least 4 scents. And in my practice, I encourage my patients to use essential oil dilutions or essential oils instead of like chemicals, right? So like not pine sol, right? But maybe like an essential oil of something with that same scent. The scents that were studied originally were rose, eucalyptus, lemon, and clove. But if you're making your own little kit, it just should be kind of a variety of different things. And the training protocol is essentially twice a day. Even if you're like, I don't really smell this thing, you want to confirm with somebody that has a great sense of smell that like, yes, that is lemon, for example. And then twice a day, you would say, okay, brain, here comes lemon. Even if you don't smell anything, and you're going to inhale, for 10 to 15 seconds and reinforce that conscious connection. Okay, this is lemon, this is lemon. And it seems kind of silly, but it has been very well studied that this is a technique that does help improve sense of smell. And when they've done real fancy studies where they look at brain activity, they've also shown that olfactory training increases the amount of activity and the connections between the different hemispheres of the brain. So something real is happening, even though it seems a little bit silly when I when I explain it to folks.
No, wow, that was great. We do the same person who asked the question and asked if you can repeat those specific smells, Dr. Villock.
Yep, the original smells were rose, eucalyptus, lemon, and clove.
Perfect. Thank you. Okay. I'm going to go to our folks that are so patient with their hands raised. I see Miss Dottie. We'll go to you first, and then Amy, and then Mr. Eldine Holtis, you'll be third. And please feel free to keep raising your hands and unmuting yourselves, okay?
Hi, thank you so much. I remember listening to maybe in 2019 when you did this. And the first question was, are you going to provide a training kit? And it sounds like what you covered is just kind of DIY.
Yeah, there are some that are available. Like if you Google olfactory training kit, because I don't want to promote a particular brand, there will be options that pop up.
And then I think in 2020, you mentioned that COVID was throwing a monkey wrench a little bit into that, and kind of like your feedback on where that's going. And the last thing is there a place that people can go to invest in this kind of medical testing that we feel like this is really a good thing?
Mm-hmm. Yeah, so the COVID wrench, that's a great question. So in all of our research going forward, I guess the answer kind of depends on the context. So for people who have said, yes, I had COVID, but I didn't lose my sense of smell, or yes, I had COVID, but my sense of smell recovered, we just are kind of making a note when we enroll them into our research that, yeah, this person had COVID, doesn't seem to be impacting them, because who knows, right? Once we have enough information, then maybe it'll become apparent that COVID is actually impacting them in some sort of unexpected way, even though they're not aware of it. For folks who continue to have olfactory loss after COVID, we have a couple of studies that are ongoing for them for 2 things. One is to monitor their sense of smell over time. We do actually, within the context of our research team, we have a study of olfactory training. So for those folks that are interested, have sense of smell loss, and want to be plugged in with our research outside of the AROMA ML, we can provide our training protocol and training kits for them as well. And usually we ask them to come back at 3 and 6 months, because we want to see how they're doing. And there's a lot of pharmaceutical interest in loss of sense of smell after COVID. And so we are a clinical trial site for a nose spray to try and help people recover their sense of smell.
Are you seeing any correlation with cognitive decline and the COVID, since the frontal lobe and the olfactory are adjacent?
Yeah, I don't have mature enough data, or data that's enough people over enough amount of time to see it, but my own personal belief is that, yes, I think that especially for those that had COVID-induced olfactory dysfunction long term, I do think that we need to be considering that as an additional risk factor for cognitive issues down the line.
Thank you for all your work.
Very good. Okay, Amy, you're next. And then Mr. Holtis.
I'm here.
Uh-oh, Amy, your sound is not great.
Okay,
So
you offering to answer?
maybe. Okay, looks like Amy is muted. Maybe she'll figure that out. Or Amy, feel free to use the chat. And then Mr. Holtis, we'll take yours next. And we'll come back to Amy.
Me?
Yes.
Yeah. All right. I have two things I think that maybe would reinforce the testing. For those of you who don't know or new here, I'm in the well brain testing part of it. It's supposed to be a healthy brain, but I would share that I have experience with my wife, my grandmother, my mother-in-law. Both died of dementia. And the interesting thing is that they both lost their taste of smell well before there was any cognitive impairment evident. So I'm also familiar up here in Smith Center, Kansas, with we are doing an early detection for dementia. We have at Smith County Family Practice, and we have Leah comes up and so forth and visits with us. What I'm wondering, Dr. Villach, would it be viable to include the olfactory testing in early detection as a monitor to start looking at things?
Mm-hmm. Yeah, that's exactly where I see the value of this. Yeah, I think absolutely. I tend to be an over-explainer, so Kelly or Mr. Holtis, you can cut me off if I'm just way getting off into the weeds. But yeah, absolutely. Kind of one of the big dreams or the big goals, because we can't, from like a population health or an everybody in the United States perspective, we can't give everybody the fanciest, most expensive tests.
Right.
And some folks are like, well, I don't know if don't know if I'm all about all that. But what we can do, for a lot of folks, getting their sense of smell tested is interesting. It's not invasive. It gives you information that you can take into your daily life. So we do envision this as adding value to patients, not only to help them be healthier and safer just generally, but absolutely as an early screening mechanism for the folks where maybe we should say, maybe you do need to get the referral to KU and the Alzheimer's Disease Center or the memory clinic or something, because it seems like something's going on, and the sense of smell test seems to support that. And so, yeah, we're hopeful that our data will continue to show that, so that we can make a compelling case as to when you go see your primary care doctor for your annual, well person exam or what have you. Yeah, they screen, they do a vision screen, there's hearing screens that are
Right.
supported, blood pressure, etc. Yeah, I feel strongly that olfaction should be one of those things that we're screening.
Good. Thank you. Because
Good.
it's interesting to me to find out that, having as old as I am, most of you know that I'm 92. And so that what we've experienced over the years, we look back now on that we thought was a natural, and it may tell us a lot more. And I also had a heart condition in 17, and I did lose my smell and taste due to the heart deal. The heart doctor said that was common to happen. So there's other triggers with it, but I think it would be great what you're doing here. All right, enough for me.
Well, thank you. Gosh, we have some really great questions, Dr. Villach, if you have a little more time. There's a question from someone who's currently participating in the study in AROMA and wondering about continuing funding. You want to address that? And then we'll go to the next one.
So as of right now, I have not received any notifications about any discontinuation of funding. I think the caveat is obviously unprecedented times. There's a lot of shenanigans afoot, generally speaking, so, we could receive a notice at any time, but I'm hopeful that the fact that we have not, is just an indication of, number one, that the funding will continue, and number two, even in turbulent times, that folks see the value of this type of research.
Great. Okay. Next, we've got a question about olfactory hallucinations in Alzheimer's or Parkinson's. And the questioner says that they have them. It can be very disconcerting. They do have mild cognitive loss and are a patient of Dr. Burns. So I think maybe just what in the world? What's going on with that is maybe the question.
Yeah, so generally speaking, when I see folks that are having olfactory hallucinations, or sometimes the fancy word for that is also phantosmia, meaning they're smelling something, but everybody else in the room would be like, no, there is no scent that's present. It is a couple of things. So I'm glad to hear that you're already plugged in with Dr. Burns and under the care of a physician who's aware of this, because otherwise things that we want to rule out are, well, could this be seizure related? You know, could this be related to some kind of tumor in the brain that's causing these extra and abnormal signals to be sent and perceived as olfaction? You know, or is it related to another kind of neurocognitive process? The data is not as strong for the role of olfactory training with olfactory hallucinations, but I have had a couple of patients where the other stuff has been ruled out, and uh, we have tried olfactory training, and that has seemed to help them. And then there's also in a very limited, because this is not a very common problem, so our clinical experience is limited, as is the amount of data that we have. But I have had success with 1 or 2 patients starting them on a medication that typically is used. It's called amitriptyline. Typically, it's used for neuropathic pain and other issues, but I've used it a couple of times here. Not saying that that would be appropriate for you, but just trying to speak to all the potential options that are out there.
Very good. Okay. Let's see. Amy did come back with her question. I'm not sure. I don't know if she's still here, Dr. Villawak, but she was asking about healthy alternatives to DM products. I don't know if I know what DM stands for, that won't adversely affect brains to help allergies. So if that rings a bell for you, Dr. Villawak, that's great. If not, maybe we can catch Amy another time. And I'll go ahead to.
The question has to do with, I had understood in dealing with the LEAP program with Rachel and Rosie, that products that like help you sleep and are also with helping with allergies, that they have a direct correlation with cognitive decline. And I wondered about some healthy alternatives for allergies.
Yeah, so are you meaning like the medications that have an antihistamine in them that oftentimes are marketed for like, take this at nighttime, etc.? Yeah, there's a couple of important things. So a lot of times those antihistamine based products, for them to make you sleepy, it has to be a type of antihistamine that crosses the blood-brain barrier. So like your products like Zyrtec and Allegra typically are not in that category, but there are older versions of those medications that do cross and can make you sleepy. And yeah, you'll sleep, but the studies show that like your sleep quality is not as good. You know, so you may be sleeping, but you may still not feel restful, etc. So yeah, I absolutely agree that it's helpful to kind of know what all the options are for allergies. A mainstay for my patients who have primarily nasal symptoms is to do things like a salt water or a saline rinse. That comes, I don't have any stock in this company, but I think it's one of the better ones that are out there. It's called Neil Med. So if you have a friend named Neil and then Med, and they make a little squeeze bottle irrigation thing where you put the nozzle in the one side and you give it a squeeze and it goes in your nose and out the other nostril. And the way that that's helpful is when you have nasal inflammation and allergies, the mucus gets stickier and thicker, which is why you feel it more and you can feel it dripping back. For some folks, it makes them cough. So using that rinse bottle kind of physically moves that stuff through. And then for most folks, nasal sprays are very well tolerated. So those are intranasal steroid sprays. So those are things like your Flonase, Nasonex, Nasacort, and then they also make an antihistamine nasal spray that works really well. Also, its generic name is Azalastin. It's available by prescription, but it's also available over the counter. If you watch television, you'll see the over the counter version advertised. It's called Astapro, but that one worked really well. And the steroid spray plus plus the Astropro or the Azelastine nasal spray, they tend to have a synergistic effect, which means they work better if you use them together, way better than you would expect if you just said, oh, this one usually benefits you this much and this one benefits you this much, so you should get this much benefit. When you actually use them together, it's higher. So they're very effective together. And for most nasal sprays, the vast majority of the medication stays in your nose, so there's not a lot of systemic absorption, so they tend to be very safe and effective.
Wonderful. You guys have such great questions. I've been trying to kind of keep up with the chat. And Dr. Vilwalk, there's one I definitely do not know and I'm very curious about. And it says, painting room specific colors to get a desired behavior. Some of you have seen my red walls in my house. So I'd love to know the answer to, can we do the same with certain odors and aromas? Oh, not odors, I think maybe odors, sorry.
Aroma, yeah, odors or aromas. Yeah, that's a great question. And there is actually a group in Japan who has been doing work on olfactory stimulation. And so in some of their initial studies, they had basically like a little patch that people would have on their sternum, and it was continuously releasing an odor. In the first study, it was I think the odor was black pepper. And I was like, ooh, that's a doozy of an odor to be constantly exposed to. But they were wondering, like, number one, how does that improve people's perception of what's around them? But there's a lot of overlap in the way that our brains receive and interpret signals, especially as they're related to all of our special senses. So smell, the vestibular system, which is telling us kind of where we are in space, hearing, etc. And what they found is that for the folks that were wearing this patch, they actually had a decreased fall risk at home. And they thought that perhaps the reason for that is because the vestibular system, which is the system that is in our inner ear, and it tells us what our head is doing, where we are in space. So you can imagine if that's not working, and like you're sitting still and your brain's telling you that you're moving, you're more likely to fall, or vice versa. But because of the overlap and how those signals are relayed, they thought, hey, maybe we're seeing a decreased fall risk because with the scent stimulation from these patches, there's some stimulation of the vestibular system as well that's making people have that system function better and decreasing their fall risk. And then as an aside, I don't have any data to support what I'm about to say, but I was aware of this connection between like memory and odors as a medical student. So what I used to do is when I was studying, I would study with like a particular scent for a particular class. And then when I was in the exam for that class, I would have like a little swipe of that same odor on my wrist. I don't know how much it helped me, but I'm here. So it didn't hurt. I made it through. But all of that to say, I think that there's a lot more that we can learn, about all of these systems. And I'm excited to be one of the folks that's studying all those things.
Yes, I mean, you're here with all this expertise. So, I mean, maybe not empirical evidence, but definitely life supporting evidence that works. So thank you, Dr. Vilwalk. I think we've gotten to all of the questions. There was someone who asked about testing available in Seattle, and I did find a link to the Washington Alzheimer's Disease Research Center. So, I mean, of course, KU is the best, but if you have to live in Seattle, they're probably okay too. Unless you know something else, Dr. Vilwalk.
No, my brother's in Seattle, so I will agree. That's fine as a place to live if you can't be in Kansas.
Okay, but hey, if your brother's there and he's got some genes related to you, then maybe they're doing all right there in Seattle. Okay, thank you, Dr. Vilwalk. We are a little over our time, and I'm so grateful for your time, and I'm so grateful for all of you who joined us today. I'll have this posted online later today if you want to review anything. We've got a commenter who says, hey, Seattle is okay. So very good. It's giving me an idea that maybe I should reach out to the ADRC in Washington and ask them to be a presenter for our webinar sometime. We'll see if they're really okay. All right.
Thank you.
So,
Thank you. This is one of the better programs again, because I'm into the early detection.
Yes.
And people don't want to do it, but this I think is an easy one, non-invasive, for
Yes.
people to try. So thank you very, very much.
All right. Yes, that thanks definitely goes to you, Dr. Vilwak. And I will just one more thing before we wrap up. Next Thursday, May 8th, our topic is another study that we're doing here at KU, and it is called MinnoCog. And the minnow is as in menopause. So we're looking at menopause and memory, and we're having women between ages 40 and 60 to participate in a study that's looking at whether there is some impact on the brain from the process of menopause. And I can tell you that I am not only going to host the webinar, I am a participant in the study. I have done it. And so we will see what they have learned so far, and we'll hear more about what that might look like. And I think there's going to be helpful information, not only for those of us who might be in the process of menopause, but also answers for brain health in general, just like all our studies, I think, even if it's not something you specifically are involved in, the more we learn about our brain health, the better. So next Thursday, we'll be talking about the MinnoCog webinar, and I will have a link to the study in the Monday newsletter in case any of you are interested in participating or know someone who might be. So stay tuned. Everybody have a great week. Dr. Vilwak, thank you very much for the great information. Everybody take care.
Thank you, Kelly.
Goodbye.
Thank you, Dr. Wilbur.
Take care. Thanks, everybody.
Okay.